Welcome to Healthy Women's new webinar series, Live with Healthy Women. Before we jump in, I'd like to introduce myself, Beth Battaglino. I'm CEO of Healthy Women, and also joining me today is Dr. Monica Mallampalli, who heads up our science team, and Helene Bader, who heads up our health education team. Helene and Monica were the idea people. They're the ones that thought about this idea and brought it to life. And we are thrilled to be launching our first program today. Now, our webinars are going to be just a little bit different from others that you have joined, as everything that we talk about will be about women and for women. And what I am excited about is that we can talk about all the important topics affecting our health and wellness, and with leading experts, health providers, thought leaders, and businesses that are all making a difference in women's health and wellness. Healthy Women is the nation's leading independent nonprofit health information source, and it is our mission to educate women ages 35 to 64 to make informed health and wellness choices. And this webinar series is another channel to do just that. Today, as we kick off our series, we will be addressing managing mental wellness in the face of the COVID-19 pandemic, which has become a critical issue for women and their loved ones. Given current events, we've decided to broaden our discussion and address how these issues are also impacting mental wellness. To examine the topic holistically, we've brought together an amazing panel of experts, including our dear friend and colleague, Linda Blount, who will share her perspectives on mental health disparities, especially among the Black community. Linda is the president and the CEO of the Black Women's Health Imperative, the only national organization dedicated solely to improving the health and the wellness of our nation's 21 million Black women and girls, physically, emotionally, and financially. Dr. Lynn Bufka is the Associate Executive Director for Practice Research and Policy at the American Psychological Association. She is also a licensed psychologist and provides treatment and clinical consultation. One of her most recent presentations for the APA was on managing your mental health during COVID-19. Also joining us is Dr. Jennifer Payne, who is the founder and director of the Johns Hopkins Women's Mood Disorder Center. In addition to providing clinical care for women with disorders, Dr. Payne conducts research on postpartum depression and management of mood disorders during and after pregnancy. She also serves on Healthy Women's Women's Health Advisory Council. And we are very fortunate to have with us today Dr. Sophia Thomas, President of the American Association of Nurse Practitioners. And as a family and pediatric nurse practitioner in New Orleans, Dr. Thomas's clinical practice has focused on providing care to medically underserved families. She also speaks extensively throughout the United States and internationally, and has addressed the stress of limited healthcare, especially during the pandemic. So thank you all for being here today around our virtual table. Fill your cup of coffee and join us for our conversation, because we're going to dive right in. We know women are more prone to depression and anxiety, and also deal with daily life stressors while juggling work and home life. We explored this issue as part of our Be Healthy Her program last fall with our partners at GCI Health, and found that 65% of women suffer from the symptoms of stress daily, and 40% of women suffer from symptoms multiple times a day. Today, with COVID-19, I am sure that 40% number of women experiencing stress multiple times a day has tripled. This new day-to-day norm not only includes our work, home life management, which seems to be a lot more in home life management now, but now many of us are also managing homeschooling, or maybe not managing it so well, while continuing the creative care for providing care to our aging parents and relatives. I'm going to kick off our conversation with Lynn. Lynn, what are the types of stressors women may be facing related to COVID-19, both during their stay-at-home time as we are preparing to start this new normal in the midst of what is happening today?
So women are facing a lot of stressors right now. As Beth said, women often report more stress, more anxiety, more depression than men. We just at APA did a recent survey looking at stress across America, and we found that parents, those with children under the age of 18 at home right now, are reporting significantly more stress than parents who don't have children at home or adults who don't have children, period, because of exactly those kinds of features that you're talking about. Managing the online learning of their children is a significant source of stress for over 70% of parents right now. It's very overwhelming, but you add in all the other things that women are typically responsible for. If they're home teleworking, the data suggests to us that they are likely the ones who are still the primary responsible person for things like food, meal planning, the majority of the child care, ensuring that everyone in the house is paying attention to their own health as well as the women paying attention to their health. So there's a lot of extra stressors that women are reporting, and they're telling us they're feeling overwhelmed. That was the #1 word that the women in our surveys reported about as they described their stress level. And then you have all the women who are considered essential workers, whether they're in healthcare and on the front lines or working in stores and providing sort of needed services for our communities. They are having significant stress in terms of worry and fear about bringing COVID home to their families, while they still do the things they need to do to support their families and to do their jobs and do them effectively. So we're seeing women really impacted in a couple of different ways here, both managing everything on the home front in this era of physical distancing and staying at home, as well as the women who are going to work and the stresses that they're facing as well.
Do you have any suggestions on how we might manage a little bit better? Any like tips that we could implement that may help us kind of off that wall a little bit?
Yeah,
Pledge.
One of the most important things for us, for anyone in dealing with stress, is social support, in finding social support. But right now, in an era where we are told that we're safer at home, we need to manage physical distance, we have to be really creative about how we get that social support. So we're using technology to do that, which is wonderful, but it may feel like an intrusion because we have technology coming at us in so many other ways as well. So I think one of the #1 things is to be creative and to try to get the kind of support that really you need. Seek it out and be creative and novel in how you're going to do that. And for those who are not able to provide the kind of support you need, that's okay right now. Don't put your energy there. Find the ones that really are sort of fulfilling you. So that would be the #1 thing. And we always want to do what we can to keep our foundation healthy. Adequate sleep, adequate physical exercise, decent nutrition and hydration. And we know people are going to eat comfort food and they might be having a glass of wine every now and then, but trying to keep your focus on the things that really do your body well, that keeps your mental well-being, your psychological health up as well too. So those are important things to do just to keep that foundation strong.
That's awesome advice. Thank you. Jennifer, knowing that 20% or more of our women are experiencing major depression along with other mental health conditions, as a practicing psychiatrist, how has the pandemic and perhaps the ongoing events impacted women already living with mental health conditions?
That's a wonderful question. We think of psychiatric illness as a combination between biological vulnerability and environmental stress. And so at any time of increased stress, women with pre-existing psychiatric disorders like major depression or generalized anxiety are going to be at a higher risk of relapse. And that is exactly what I'm seeing. So I do a lot of outpatient work, and I am literally cramming people into nooks and crannies in my schedule in order to see them, because so many women are decompensating right now. And part of my evaluation is to treat the psychiatric illness, but to also offer advice, like Lynn just was, about how to manage stress and anxiety during this pandemic. And I often try to get people to see that this is an opportunity for us to learn how to manage stress, and that we can manage stress. But it takes making a plan. It takes saying, okay, I am going to eat healthy, and therefore I will only buy healthy food. I'm going to exercise regularly, and here's how that is going to look like. So I think it's really important to not just think about psychiatric illness, but psychological wellness as well, both for women with and without mood disorders and anxiety disorders.
Couldn't agree more. Thank you. And Sophia, as a frontline provider and a nurse practitioner, can you share with us 2 or 3 of the biggest patient concerns you're seeing and how you are addressing them?
So that's a very interesting question. And my practice is a very multicultural, diverse group of patients and families. So really the things that I'm seeing from women range from, how do I homeschool my child? I'm a single mom and I have to work. If I go to work, am I going to get COVID-19 and bring it home to my family? What do I do about testing? Who needs to be tested? How do I protect us from getting the infection? If one of my family members has COVID-19 and brings it home, what do we all do? And so very much those answers have to be individualized based on the family and what their resources are and what their capabilities are. Certainly for the question regarding homeschooling, I'm very glad school is over with now for most of the country, because for some of my patients, homeschooling on Zoom and these other platforms was fine. They had internet access, they had computers or tablets and things like that, but that's not available to everybody. And some patients don't have access to those. Some people don't have good Wi-Fi access. And certainly for me as a clinician, it was very difficult doing telemedicine with some of my patients who had poor Wi-Fi access. So very much the challenges that people face are individualized based on their socioeconomic status. What I do with my patients is I take each family's concerns individually. When somebody has COVID-19, you're supposed to get them at home, isolate them in one room. They have very little contact, but that's not possible for everybody. Some families just have a 2 or 3 room home, and there may be extended families living within the home. And certainly I've seen one family member catch COVID, bring it home, and had most of the household end up catching the infection just from the close living conditions. So, I talk to them very individually about what their concerns are. We work on the best ways that we can handle their stress, the ways that we can problem solve. A lot of these times we can make generalizations about what should be done, but in practice, it's not always a cookie cutter answer. Yeah. And so we have to look at things individually and deal with what's important to each woman as a separate issue. What's important to me and what my concerns are may not be important to what another individual's concerns are. Mm-hmm. So I very much try to make my advice, my answers very individualized based on what the patient's concerns are, what their needs are, what their resources are, and what they're capable of as well.
Thank you. Your patients are lucky to have you. Linda, Linda, as noted in your national health policy agenda, the majority of racial disparities in mental health exist in regard to mental health care, services, and we know that Black women in particular, and women of color in general, face not only the stresses of sexism and classism, but also the stresses of racism. These mental health disparities have been further exposed during the pandemic. Can you speak to this issue and to what our panelists have just discussed?
Yeah, and thanks, Beth and Monica, for doing this. It's really important to have this conversation. This is a really difficult time for a variety of reasons, which will affect the mental health of everyone, of the nation, frankly. And as you pointed out, when you look at the data, and I'm an epidemiologist, so I tend to look at these issues through the lens of data. There's no statistically significant difference in rates of depression, for example, between Black women and white women, and Hispanic women. They're about the same. But where we see the differences, the disparities that you're talking about, are in access to diagnosis and then treatment. Black women are at best half as likely to have a mental illness diagnosed and treated successfully. And so we can't really separate these issues of what it means to be a woman, what it means to be a Black woman, and depending on your socioeconomic status, how that plays into it. 30 years ago, Kimberly Crenshaw coined a term called intersectionality, where she looked at the intersection of race and class and gender and talked about how that works against Black women in society and how it limits their access to good jobs, good education, healthcare, for example. And when we think about stress, I mean, as the panelists all know, Black women have at any point in time about 15% more cortisol, which is a stress hormone, in their bloodstreams than white women. And I'm particularly concerned that it could be even more now. I think all of our cortisol levels have increased right now. But what that does is it triggers our inflammatory response, which raises our risk for hypertension, diabetes, cardiovascular disease. But it also changes our metabolic response. So we can now draw a straight line to obesity from elevated cortisol levels. And in media, we talk about Black women being 80% overweight or obese, but we don't talk about those underlying causes. And we know the role of stress and racially mediated stress plays. And when I think about COVID-19, 4 months ago, it was, Black people aren't getting it. Now it's, Black people get it. So, we don't need to worry about it. But of course, that's not true. We're obviously being infected at higher rates, and depending on what city you're in, the mortality rates are 7 times that of the rest of the population. And as a couple panelists mentioned, essential workers now, we have this sort of double-edged sword of women being laid off, so they're at home, not earning an income, but still having to keep running the household, feeding the family, taking care of the kids, homeschooling. But then there are those women who have to go to work, those essential workers who often have to face an unmasked public that is really angry and run the risk of bringing COVID-19 back home to their families. And then we have that against the backdrop of the senseless killing of George Floyd and so many others. So, when I think about this, the thing that sort of crystallizes this for me is a conversation I had literally this morning, where a woman sent a picture of her son, who's in college, he's home now, to their neighborhood app and said, here's my son, he's in sports, he likes to run. If you see him running around the neighborhood, he's my son. I can't imagine anything more impactful to my mental health than having to essentially warn my neighbors, don't call the police on my son, don't think something's wrong because my son is running around the neighborhood and getting the exercise that he should be getting. So we really have to look at the disparities through this lens of gender, of class, of racism, to really understand kind of what the Black population is feeling, but also how it affects everyone on this call, our children, and the nation, because we cannot separate these at all.
Thank you, Linda. We are now going to open up for questions. Monica, do we have any questions?
Not so far. Let's just wait for a minute or two. But we have some questions from our Healthy Women team. So let me pose one to Lynn. Lynn, what can women expect with regard to the delivery of mental health services moving forward? And again, have you been utilizing telemedicine, or do you see this playing a bigger role in the near future? Does this work? I think this is applicable to our other panelists as well.
Lynn is muted.
Muted.
I'm unmuted now, thank you. So it is a very challenging time right now. Certainly we are seeing increasing numbers of, as Jennifer is describing, increasing numbers of people beginning to return to treatment, seeking treatment, wanting treatment right now. Telemedicine, the beautiful thing about telehealth is it's effective. And when it comes to mental health, it is one of the easiest ways to translate healthcare, right? Most of what we do is talking to people, and we can use that through telehealth. So for those who are really wanting to have mental health care right now, go for it. I realize it may not be possible for everyone resource-wise, time-wise, but I think you should know that it is something that's very effective when it's delivered via telehealth. So I really want to make sure everyone listening is aware of that, and that there are some very important ways of getting care right now. It can be a challenge to find that care. And that's one of the things that's so hard. When you're stressed, when you're overwhelmed, when you're depressed, the last thing you have energy for is to go find healthcare. But talk to people that you're connected to. They will make referrals for you, give you ideas of who is there. And that care, I know this is true for psychologists. I know this is true across specialists in mental health care, that they have very quickly transitioned to be able to provide effective care via technology. So it's important to seek that when we're overwhelmed and we can't manage and we can't do what we're doing. It doesn't do us any good to not get the care. We can't do our world any better if we can't take care of ourselves. So it is important to do that.
Yeah. Jennifer, Sophia?
I'll say that I literally transformed my very busy outpatient practice into telemedicine overnight. And my children are very impressed with my use of Zoom. And it's been a really wonderful thing. It's you know, it was something that I hadn't really thought much about, but I actually think it increases access to care. People, you know, don't have to get babysitters for their children. They don't have to drive somewhere, pay for parking, come into, you know, I work in inner city Baltimore, and, you know, I have patients who come from Delaware, Pennsylvania, Virginia, and a lot of those barriers are being broken down by telemedicine. I'm having a much lower no-show rate, and because things aren't getting in the way of it. The other thing that I think from a psychiatric perspective, sometimes it's easier for people to seek psychiatric or therapeutic care from the safety of their own home. So instead of being nervous about walking into a psychiatrist's office, they can seek care, you know, from their home or work environment, and get the help that they need. So I think it's actually a good thing. I don't think we'll be going backwards anytime soon. I think this is here to stay. And there are definitely things we need to think through, that there are some people without access, but it has been a really good thing for most of my patients.
And I'd agree. I think telehealth is staying with us for the future for mental health care as well as overall health care, managing chronic conditions, et cetera. And it does improve access to care for all people. Before COVID-19, telehealth was just reserved for Medicare patients in rural areas that really didn't have access. But we know that there are people all over this country that lack health care access. Certainly in my state of Louisiana, a large percentage of the state is considered a health professional shortage area.
Mm-hmm.
So by instituting telehealth and allowing access to care for people that would otherwise go without, we can actually improve the overall health and wellness of our citizens. Many people lack adequate transportation, or they have to take a bus for 3 hours to get to a health clinic. And that's unacceptable. We really have to do more. And I think this is a time when we can really look at doing some very forward-thinking things to improve access to care for all patients, improve the health disparities, because we know COVID-19 has really shone a light on the health disparities on this country. And we, as a country, need to come together and do more to improve overall health wellness, including mental health of all patients.
And Monica, if I could just add to just what Sophia and Jennifer and Lynn have said, because that is exactly right. I would also think telemedicine has the opportunity to do two things. One, reduce stigma about seeking mental health care, because you don't have to make a big deal out of it. If you have access, you can do it from perhaps the privacy of your own home. But also what I've heard is many providers have said that it seems that they think there's a real potential to help with provider bias, because you see what is happening in the home. You've got the woman, you're looking at what's happening around her, and you get a much better appreciation for, frankly, what her lived experience is. And I'm talked to several providers who said that actually they think that's actually going to help provide better care, because they really get a sense of what's happening in her life and the kinds of stresses or issues she's dealing with, and they can better provide the sort of support and service that she needs.
Right. We have actually two questions here. Let me read the first one. This is from Dr. Rena Ferguson. Any suggestions for those that are quarantined with abusive partners or where you suspect child abuse? Thank you.
So I think that's the downside of this quarantine, is that there are a lot of uncomfortable families out there, and violence is increasing in the home in that setting and not being detected by outside agencies. I think the advice is to try to de-escalate things as much as possible, and then reach out for supports. There are all kinds of support lines for child abuse, for domestic abuse. There are resources online, and I would just really encourage reaching out for help.
Yeah, this is a very difficult time because you don't have some of the ways that you might have had before to de-escalate things. You can't necessarily walk out the door, or the other person can't walk out the door to calm down. Particularly concerned about the families where the living space itself is quite small. So where there may have been a lot of conflict and tension, there's even greater potential there for control for the kinds of violence that leads to abuse. I know that we're very concerned about the incidence of child abuse with children in particular right now, because we don't have teachers available there to see. As Dr. Payne said, there are supports out there, there are hotlines, there are ways to get help, but it's even harder when you're under the scrutiny of an abuser. This is an opportunity to the extent that you can, if somebody's in that situation, if you are not the person who's in the abusive situation, but you are aware of what the clear resources are in your community, any way you can find to securely and confidentially convey that information to the person, because they are going to be in even less position to search that out if they are under the nose of whoever is abusing. So that is one important thing that those of us who are providing care can do to the individuals as we meet them, to let them know in a secure and confidential way what those resources are, so that they aren't potentially seen searching for that kind of assistance when they're in such a closed environment.
Monica, you're muted.
Oh, sorry. Thank you. What are the practical solutions for women who are seeking mental health care but lost their jobs, so don't have insurance, or have insurance but the coverage does not cover mental health care? Where can these women go for resources and support?
There's a lot of resources that are out there. As I said, it's very hard to find them when you're feeling distressed and overwhelmed, though. That's if you are employed and there's an employee assistance program in your company, definitely check that out. It's right there ready to provide you with some help and some guidance. Not every employer offers that. In many places, there cannot be disparities in terms of what the mental health coverage is and the physical health coverage if mental health coverage is part of the plan. So there could be some parity issues that have been rectified with recent laws that you may not be aware of. So definitely try to pursue that if you do have health insurance coverage. Look at local community health organizations. Those often have sources for care. Colleges and universities may have training clinics where you can get low fee access to care. You can call a provider and talk with them about the situation that you're in and see if they have any flexibility to offer a sliding scale or a payment plan for you. So it's hard to do that when you're overwhelmed, stressed, or depressed, but it's really imperative to do so. And many providers want to find out how to do that. Many local communities have low fee, low cost kinds of resources, but it requires looking for that. Talk to your primary care provider if you have one. Ask them if they know of resources. That's often a good starting place as well. Others on the panel may have ideas about that too.
I would also say, as you said, reach out to your local community health center. For people who are uninsured, underinsured, there are resources at community health centers. I actually practice at one. And so many community health centers have physical health, behavioral health, and advanced resources, and know all of the community resources out there for people who may need more than just counseling or therapy. They're more targeted resources. So definitely your community health resources, which are scattered throughout the country, would be a great starting point too.
The other thing I would add as a psychiatrist is that many frontline primary care providers can at least initiate, if not complete, medication for major depression, for anxiety disorders. And so you don't necessarily have to be evaluated by a psychiatrist in order to start treatment. So talk to your primary care doctor, your OB-GYN. We're working hard to train other frontline providers how to start psychiatric medications and to assess for psychiatric illness. So if you have healthcare but don't think you have mental health services, start with your primary care doctor and get into treatment.
There's some hope on the horizon as we're working on some legislation to expand Medicaid, make it available for those who lost their jobs so they can get covered, and to extend the coverage of Medicaid. In states that haven't expanded it, it's going to be a challenge, obviously, but where states have expanded, we're really pushing for legislation to cover longer and a wider variety of conditions, particularly coming out of COVID-19. And I suspect we're going to see even more coming out of the unrest over George Floyd's death in the last couple of weeks.
Well, thank you all for that. We have another question. This is for Linda and Sophia from Kristen McBride. Recognizing that this is a very complicated and deeply systematic issue, what are some of the steps people, and asking from the lens of a white woman, can take to help improve health disparities and access to quality care? How can we help positively influence the dialogue for change?
Well, one place to start is just understanding the issues. When we look at health disparities, it's really important to understand there's no biologic or genetic determinant for these. These health disparities that exist are completely socially, politically, and economically mediated. So you've got to understand that. I can't tell you how many times I've heard people say, well, if they would only, it is not that group's responsibility or frankly even ability to change the disparities. Yes, we all have the responsibility to do the things we can do to take care of ourselves. So it's understanding that, but it's also understanding the systems in your community and how those systems contribute to the disparities. Whether it's your education system, we know how public education is funded through a tax base. Well, if you're in an area of persistent poverty, you're not going to have good schools, likely good public schools. So it's really understanding where the systems are and where your political particularly local political leaders stand on this issue, and then make your voice known. Understand the issues, go to them and say, look, there's no reason to have these kinds of policies in place. In fact, here's what they're doing that harms this community, and speak up early and often.
I would agree with that. I think it's very important that we understand the crux of what the issues are within the Black community, how these things began. You talk about community red lines, multiple social determinants of health, things like access to quality food, education. Right now, your zip code actually is more of a factor in figuring out what your healthcare outcomes are going to be than other factors. So more so than genetics. So it's important to really understand what the issues are, how use the word structural racism, how society has been built to actually hinder the Black community from achieving equal outcomes in healthcare, education, and things like that. We have a system where if a woman gets married, she would no longer be eligible for financial assistance or Medicaid. And so society is actually, in some of these rules, preventing women from getting married and having a man in the household to help raise the children. So there are lots of factors that are influencing what's going on today. I think it's very important that people, before or judging, really take a hard look and try to figure out the facts and how the community is being affected. Show some empathy, because I don't know what it's like to walk in Linda's shoes. I've never walked in Linda's shoes. I have 3 white boys, and I can send them out on the street and go play, and I know they're going to come home. But not everybody can say that. And so I think it's, as a mother, and we're talking about women right now, I've also seen in my practice that Black women are the most empowering, most supportive of their families, and you talk about mothers, grandmothers. So I think that it's time for us to have a conversation as human beings and really understand how each other thinks without being judgmental, but understand the process and the policies and find ways that we can work together to improve, because no matter what happens, the beneficiaries are going to be our children and the community. So I think it's time for everybody to work, listen, and work together to make a better community for all.
Thank you.
Thank you for that. We have couple other questions. I'm going to try and get to this. One is about about telemedicine. Telemedicine is opening new doors for many people, but are there other alternatives for people who do not have access to internet or a computer with cameras? I feel as though those people do not have transportation access either. Are there any other resources?
You know, actually, phone therapy. So audio only therapy, also effective. And in many jurisdictions, if not all, covered by insurance. So if you have insurance, it's going to get paid for. I can tell you my organization at APA, we are advocating hard for that to continue. And I'm sure we're joining with our other colleagues in related disciplines for that as well. So phone is really good. We've been doing it for a long time. We know it can be effective. So definitely phone is an option for traditional kinds of services as well. We also need to do a lot more to broaden the reach of mental health ideas, wellness, support in all of our communities, in the places where people are, in work, in churches, in schools, so that it's not something that you have to go to a specialist to see, to do, to experience, that it is part of everyone's lives. That's a lot of work on the ends of people like me who are professionals in this domain, where we've got to figure it out, but we've got to be partnering with our local communities to ensure that the kinds of mental health capabilities are embedded there and available. But right now, I'm telling you, phone works, and people are doing that as well. So that is one definite option when it comes to mental health care.
Yeah, I had several patients with whom I'm doing phone visits, and I don't think it's as good as a video visit because I can't see their eyes and their expression, but it definitely does work and can be a really good support. As a society, I would like to see us move towards putting telemedicine into communities with poor access to other resources. So it's not that hard as a society for us to set up a telemedicine clinic in places that don't have many resources. And so I think as a society, we need to be thinking more broadly about how can we bring the experts to the communities that need it. And I think that's going to include telemedicine, but it may mean that that's not on an individual basis, but more on a community basis.
And one of the things we need to think about, to Jennifer's point, is why are there communities with poor access to these resources in the first place? I mean, there's no reason for that. You know, there are providers, there's money. You know, this is an issue of political will. But I do want to touch on Lynn's point, because it's great, and I appreciate, Jennifer. It's not as good as seeing people face to face, but given where we are now, and when there's such high degrees, levels of stress, and particularly around intimate partner violence that we mentioned earlier, texting is also something that we need to consider. Phone records can be examined, texts can be deleted. So under duress, I would love it if you all would sort of speak to this. Would you be willing to have a text conversation with your patients if necessary?
I have on a number of occasions. A lot of my patients will text me. A lot of my patients will email me. But texting can actually be very important. I've had a number of very anxious pregnant women who needed to be on psychiatric medications. And so I decided I was going to text them every day. Did you take your medicine? Go take your medicine. Let me know when you've taken your medicine. And that worked. So I completely agree with you. There are other modes of communication that we need to avail ourselves of.
Yeah, texting definitely can be a wonderful support to a relationship. I am concerned about text only as the only way of communicating with the provider. However, if that's all you've got going, that's what you can access, try it. My concern in that is the capacity to respond quickly in emergencies, to be connected to the local community, to develop the kind of relationship that we know really makes a difference when providing care. But absolutely, I text with patients as well. I think it's critical.
And I think what's great about texting with patients is that there's a personal communication outside the office, and you're giving them, I actually had a patient text me at 9 o'clock last night. So I think it's great to be able to provide those non-traditional communications, because, you know, not only are we giving them the answers they need or the resources, but, you know, I'm letting them know that I care about them. I care about you beyond 8 to 5, Monday through Friday. Text me at 9 o'clock at night and I'm responding to you. And I think that means a lot for patients. I know me as an individual, if somebody took the time to answer my text beyond their regular work hours, I know I would appreciate it.
Yeah.
So Beth, I'm going to pass it back to you if you want to ask the final question.
So it's going to be the Healthy Women Rapid Roundup. Ladies, what is the one thing you want our audience to take away from this discussion today? Lynn?
I want you to know that you have some capability to direct your mental health and well-being, that you have tools in a community that wants to support you in being your best, but it's okay to reach out to others to get the support that you need, that you can't do it all alone all the time, but to be the best you and the best woman, the best mom, the best wife, the best partner, whatever roles you're in, taking care of you becomes just as critical as taking care of others in those roles.
Thank you. Jennifer?
Make a plan. I think we all have to make a plan on how we manage our stress and anxiety during these really troubled times. And also, if you are really struggling, please seek care. Go see a doctor, whether that's a psychiatrist, a therapist, a nurse practitioner, a primary care doctor. Seek help and get treatment. There's really good treatment available.
Linda?
Yeah, so I would say, you know, the pain is real, the fear is real, and that's okay. There's nothing wrong with you whatsoever, and people need to understand that the disparities also are real, but there are also real solutions, and they don't have to exist. So speak up early and often. A few months from now, I think, what was it? Was it 22 weeks from now? There's a big day, that first Tuesday in November. You get a chance to really make your voice heard and put the kind of people in office who understand these issues and who will work very hard to change the structural barriers that Black women, and frankly, all women, face in trying to be as healthy as they possibly can.
Thank you. And Sophia?
I think women are, we're the rock of the house. We're the rock of the household. And with that comes a lot of burden on our shoulders. And I want everyone to know we're all in this together. So, as far as COVID-19, this is our new reality. As far as all the disparity and all the stress that's going on in the community as a result of George Floyd's murder, I think that this is a time for all of us to come together as sisters, as humans, and listen to each other, be empathetic, work together, and women can be the solution. And I think that's the most important thing. So everyone's voice counts, and it's just be dedicated to making our communities a better place.
Thank you. Thank you so much for your candor and your insights. And to those of you who have joined us, if you've been doing something that has been working for you, or if you're going to implement something that you've learned here today, please tweet to @HealthyWomen. And if you have any suggestions for future topics, and you can email them info@healthywomen.org. I would like to thank the speakers and the participants for joining us today on Live with Healthy Women. For the questions we were unable to answer, we will compile the responses and share with all of our webinar attendees. For more resources around these and other women's health topics, please visit us at healthywomen.org. On behalf of myself and the entire Healthy Women team, please stay safe and be well. Thank you.